Good day. My name is Damla Radeomi, and currently talking about MedCloud. MedCloud is a system to manage health sector in Nigeria and Africa, to build a template for hospitals, patient record access management across medical facilities, data management for medical bodies and governments, and human resources. There are four things that MedCloud helps to do. One, we build a template for hospitals. Um, In hospitals, patients are being handled as cases, and for each case, there is a procedure that needs to be followed. Now, these procedures are not often followed. Most hospitals are guilty of those procedures. Hospitals that requires higher payment, they do follow the process up to 80 to 100%. Um, and lesser hospitals, hospitals on the low line, hospitals that requires that meets a lesser audience, it's just a 40 to 60% um, that they follow the procedures. So MedCloud helps to build a template that states all those procedures and they have to be followed. Now, secondly, um, patient record access management across facilities. Now, most hospitals, the patients' records are locked into the facilities. So that's the reason why most patients stick to one hospital because the medical record, the patient record cannot be accessed across hospitals. So MedCloud enables this. Now, how do we achieve these two tasks? How do we build a template and how do we access it, make the patient record access management accessed across medical facilities? Um, MedCloud is a tenancy system, um, meaning that the facilities are tenants on board, and when they register with us, they'll be able to bring in their own members. So the receptionist, the nurse, the medical officer, the doctors, and all the staff, they all log into our platform to be able to perform their daily tasks. So the receptionist logs in to be able to check in the patient. The nurse log in to be able to take the vitals of the patient. So the medical officer, the doctor, they log in to be able to do their consultation, and all the process of the consultation has been stated on our website. So with these, we have built a template for them for all the tasks they need to be doing, even up to antenatal care, postnatal care, and neonatal care. We build all the process that needs to be followed. So with these, all the template provide the same services. They provide the same services, and so this data too, because they are operating on the same hub, on the same database, the data can also be accessed across the medical facilities. Then thirdly, we do data management. The data that we have, they can easily use it for their own management, and also the medical bodies can also pick some of this data for management, and the government who owns the data in general can also use this data for management. And fourthly, we do human resources. So our website also provide a form for registration for medical staff. So the staff, they registers on board and they can easily be employed by the facility manager. We don't do recruitment. We just provide their data. So the medical facility manager still needs to do their due diligence on the staff they are employing on board. Now, because hospital is made up of several services. In hospitals, they have their own medical services, they have a laboratory, and they also have a pharmacy. So these three are the tenants that comes on board in our system. So the for the medical for the hospital, we already have all the tasks that they need to perform. So when you create an account as a medical as an hospital, you'll be able to fill out the form for all the service that you do, all the laboratory tests that you do, and you'll be able to bring your members to can also log in into your own platform to be able to perform their daily task. And also the pharmacy too, we also have the inventory for them to be able to we also have an inventory for them to be able to manage their drugs and also their items. Now inventory is a real time because they sell the drugs on our platform. So it's actually a real time. It's not just we're not just keeping they're not just keeping their data there, but it's in a real time. So because of this, they can also be able to know their profit. They can know the number of drugs they have. They can know the cost of the facility. So these actually eliminate paper in the hospital settings and also in the pharmacy settings. So we also have the laboratory, which is also under facility too. The laboratory we when they register, we have a list of tests, more than 500 tests that they can click and put their price, and they can be able to select the test for the customer, and also put the results, and also be able to also see their sales in the laboratory section. So, and our hospital, it's not just for the private. We also have a section for the public. We also have for public. We also have for healthcare centers, and also um, health centers. And so now, talking about the website generally, so I'm going to be making about the overview about the front page. So on the website, when you go to on MedCloud, we have posts. Those posts are actually provided by the medical officer, the doctors, the nurse, and the medical staff. And this post, the articles are actually approved by the facility manager and also the admin of MedCloud. Our website helps to keep the IP address of each user who visit the website. So with the IP address, we can get the geolocation of the user, and with the geolocation, we can list out the pharmacy in that geolocation. We can list out the medical laboratory in that geolocation, and we can also list the hospital, private hospital, and the public hospital in that geolocation. Um, on the bottom part of the website, we have some searches. So a user can search for drugs. If I search for paracetamol here, I can see the paracetamol, the quantity. It's a real time because they sell on our platform, so you can actually know the quantity they have in their store. So we can see the quantity, we can see the price, you can see the facility where you can get it. We can also see the address of where you can get the facility where you can get the drug. So it's a real-time search. Then we also have medical search for medical diagnosis and laboratory tests. So we search for blood, so I can see prices of blood tests, and I can also see the facility, the address, and the phone number that I can get it. So then finally, you can search through medical services. If I search for cardiology, so I can see the facility that I can get this test, the price, the address. So the price, these price services are actually added by the hospital during their registration process, and they can put the price, and the price is updated, can be updated whenever they want to, and we can see the address and the phone number what we have. And lastly, our website helps to pull out data because it's a website that's a real-time base. All of their tasks are being performed. So we have the database. We have the database for all the hospitals. So this is just like an hub for all medical in the country. Whereby, so with these, we can easily get a number of beds across medical hospitals for that location, that state, and that year. You can also get it for the month. You can also get it for the week. You can also get it for the day. So we have the number of bed. We have the number of bed mortality, the prenatals and antenatal patient. What is the average antenatal visit? What is the new kid born? What is the immunization of the kids? How often are it? So we have the data. So we can easily pull out data for the year and for the location as well too. So we also have the login path whereby you can log in either as a medical staff or a staff or a patient, and we also have a patient path. The patient can also register, and they can as well log in to be able to see their visits, see their hospital visit, the last time they visited the hospital, and what are the data that was captured during their visit. So the patient also can register as well too. So the medical staff also register here, and the facility also register here. So this is the overview about MedCloud, and this is what MedCloud does. This is the objective of MedCloud. Thank you.